Hello, welcome to today's webinar, Supporting the Frontline, a public health approach to dementia caregiving. Thank you all very much for joining us today. We really hope it's an informative time for everyone. My name is John Shean. I'm the Associate Director of Public Health for the Alzheimer's Association, and I'm joined by my colleague Molly French, the Director of Public Health here in the Washington, D.C. Public Policy Office. We're really excited for today's webinar. It's designed to bring a strong public health focus to the issue of caregiving in our communities, especially to caregiving for people with Alzheimer's or other dementias. As we're going to hear today, public health agencies across the country are already taking innovative approaches to address dementia caregiving, helping to prepare and support this population. Today, we are also going to hear new data on caregiving and dementia caregiving from the Centers for Disease Control and Prevention, the CDC, as well as hear about resources to help incorporate this topic into a variety of public health disciplines. Just a few housekeeping items before we get started today. On your screen, you're going to see today's agenda, and please know that we are recording today's webinar so that it is available to anyone who couldn't join. In the coming days, we'll be sure to send out a copy of the slide deck, a link to that recording, and links featured on today's presentation. All phone lines have been muted, and we are going to take question and answer throughout the presentation via the Q&A box. In the platform on your screen right now, you should be able to find the Q&A section either along the top of your screen, sometimes it's along the right-hand side of your screen, but please utilize that box to ask any questions throughout the presentation today. I'd also like to take this time to acknowledge the CDC for the cooperative agreement that enables us to offer this webinar, but please do know that the opinions expressed during the webinar are solely those of the speakers. Speaking of the speakers, we have a great set of speakers for you today, whom you see on the screen, and I'll introduce them before each of their presentations. I'm also pleased to say that we'll hear from the National Alliance for Caregiving, who's going to help provide some context and translation to anyone listening today who are hoping to take the next step in caregiving in their own work. Please be sure to stay on until the end to hear about a new funding opportunity from CDC at the end of today's session. Excuse me. Before we do dive in, I want to take a quick minute to provide some resources and special consideration for dementia caregivers as our country, as the whole world continues to battle the novel coronavirus pandemic. People living with dementia are one of our most vulnerable populations and may require special consideration in order to remain healthy. To this end, the Alzheimer's Association has released a set of recommendations for caregivers, and we really encourage them to consider what might happen, make alternative plans should they themselves become sick or unable to provide care. As cognitive decline worsens, people living with dementia may forget or not understand proper hand hygiene or social distancing practices. So caregivers can model this behavior and provide reminders as needed, while also monitoring for active symptoms of infection, which include fever, discomfort, a sudden change in behavior. As we know, and as many of you know, as many of your colleagues are directly on the front line of this pandemic, personal protective equipment is in short supply. If caregivers are in an area fortunate enough to have an adequate supply of PPE, we do encourage that caregivers be provided with PPE in order to protect themselves as well as their vulnerable loved one with dementia. These are just a few considerations for the COVID-19 response, and I encourage everyone to stay up to date at alz.org/COVID-19 as well as cdc.gov/COVID-19. For the bulk of today's webinar, dementia caregiving, why is it a public health concern? And this is really for a couple of reasons. The burden is large and the impact is major. There are currently over 5 million Americans living with Alzheimer's in the United States, and a staggering 16 million friends, family members, and neighbors provide unpaid care or assistance to them. For those dementia caregivers, the work is long, intense, and personal. And last year alone, we know that they provided over 18 billion hours of care to those living with dementia. As we're going to hear later today, nearly a third of those caregivers are providing 20 or more hours of care per week on average, and a subset of them are providing up to 40 hours of care per week. Certainly long, certainly intense caregiving responsibilities. And just as one bullet point on the screen, the impact is certainly major. We see that the value of that unpaid care, again, unpaid care, is over $244 billion. That's a large number, and just to give it some context, In comparison, the cost of the cost to health and long-term care systems for caring for people with dementia is $305 billion this year. So we see that dementia caregivers provide nearly an equal value to our loved ones living with dementia as our health and long-term care systems do. We know that the burden is certainly large, the impact is certainly major, and we know that there are ways that public health can intervene. One method I encourage everyone listening today to consider is using a chief health strategist approach. As our public health systems continue to be driven by data, to be driven by community input, caregiving, and specifically dementia caregiving, requires more attention as a pressing health issue. With the aging of the baby boom generation, more older adults with chronic conditions or disabilities are going to need care in the future, so public health today can consider and plan for that need. This includes things like conducting needs assessment to measure your community's current ability to meet their needs and better identify gaps. This is especially important, as we know, for health equity, identifying populations that are underserved, and establishing partnerships that can better serve that population, better meet their needs, and help reduce health disparities. Public health can ensure that planning and evaluation incorporate caregivers into that development process and strategically align their needs to other vulnerable populations within the community. So as you hear from our presentations, from our speakers today, keep in mind this chief health strategist approach and how you may be able to incorporate the need for planning, the need for development into better addressing caregiving issues within your jurisdiction. Keeping that in mind, I encourage you all to think about how, within your own capacity, within your own jurisdiction, you may be able to ensure that caregivers have access to supports and services. What are better ways to educate caregivers about providing quality care, or educating caregivers about ways to maintain their own health, and how to continuously evaluate and improve outcomes. Again, today's webinar is really designed to help generate some ideas, spark some interest, and hopefully get some ideas flowing for how you can address caregiving within your communities. One tool to help you do this, and one tool to support the broader public health field, is the Healthy Brain Initiative, and specifically the Healthy Brain Initiative Roadmap series. In case you're unfamiliar, the Healthy Brain Initiative is a public-private collaboration designed to advance cognitive health as an integral component of public health. It's housed at CDC within the Alzheimer's Disease and Healthy Aging program, and the Hpi Roadmap series is designed to offer practical and expert-guided actions that state, local, and tribal public health leaders can take to better address Alzheimer's, help reduce the risk of cognitive decline, and better meet the needs of caregivers. On your screen, right in the middle, you see the third iteration of the Hpi Roadmap. It's designed specifically for state and local public health leaders. And on the right-hand side, you see the roadmap for Indian country. This is the first ever guide designed to start conversations about dementia in American Indian and Alaska Native communities. While today's webinar is going to feature presentations at the state public health level, several resources are available for any public health leader currently serving Indian country, including an evidence-based educational program for caregivers, the Savvy Caregiver program in Indian country. The roadmap for Indian country goes into more detail about this program, as well as actually highlighting an innovative approach that the St. Regis Mohawk Nation in upstate New York is taking to better assist caregivers. We're not going to go into it today, but I encourage you to take a look and learn more at alz.org/public health. At this time, I'm very pleased to introduce our first speaker. Dr. Babak Nayeri serves as the State Director of Healthy Aging for the Arizona Department of Health Services in the Bureau of Chronic Disease and Health Promotions. In this role, Dr. Nayeri serves numerous capacities, including chairperson of the Arizona Attorney General's Health and Safety Committee, as well as the military liaison for the Arizona Healthcare Executives, which is the state chapter of the American College of Healthcare Executives. Dr. Nayeri is a clinical associate professor at the University of Arizona, College of Medicine and Geriatrics, General Internal Medicine, and Palliative Medicine, and has several additional faculty positions within the state. Recently, Dr. Nayeri was recognized as a faculty fellow at the Arizona State University Center for Innovation in Health and Resilient Aging. Thank you so much for joining us today. The presentation is yours.
Thank you, John. Greetings, everyone. And John, you're hired. You did such a fabulous job teeing this up for us with and framing the presentations today. Thank you very much. I will start by sharing with everyone a quote from Dr. David Satcher, for our former Surgeon General and former CDC Director. Dr. Satcher said, Alzheimer's is the most under-recognized threat to public health in the 21st century. And along those lines, all of us are seeing the rapid growth, and exponential growth of Alzheimer's disease and related dementias in our nation. Alzheimer's is the fourth leading cause of death in Arizona, third among women 65 years and older. Next. John, thank you. So many of us know that because of the changes in the birth rates, the older birth rates, and our parents getting older, otherwise referred to as the sandwich generation, everything that we do in public health, all the first or primary, secondary, and tertiary interventions that we employ will support 3 generations. So the pictures that you're seeing on your screen are pictures of an actual people who are caregivers, unpaid caregivers, and their loved ones, their family members who are afflicted with Alzheimer's disease and or related dementias. This is a traveling photo exhibit that I will be sharing more about, and Duet Partners in Aging in Arizona, a nonprofit organization, has put this traveling exhibit together, and we share this at our various educational opportunities. Next, John. I wanted to share these pictures with you. These are some selected photos from Tony Luciani, whose mother has dementia, and just to show the burden of dementia and the different phases of dementia. That's John's mother in the picture, whom he's holding. If you get a chance, Google him and look up all his work. It's just fascinating the way he has employed his art of photography in raising awareness about dementia. We know that dementia has a tremendous burden on caregivers, resulting from multiple physical, psychological, social, and financial stressors associated with caregiving. Burdens are particularly high in neurodegenerative disease, given the progressive disability that may occur over years. And we know that oftentimes the burden on caregivers who are also often afflicted with multiple chronic conditions end up impacting the lifespan of caregivers much more than the person who has dementia or Alzheimer's. If you would, John, next, please. Thank you. So we know that John, with the caregivers population, myself being a long-distance caregiver, we know that there tends to be loneliness, and this is the picture on the upper left-hand corner, is depicting the loneliness that we feel and the isolation that often arise from being a caregiver. The depression, anxiety, stress, and these are all real when it comes to caregiving, and especially during these times as the current crises have substantially changed our lives. We know that sometimes none of us can escape having at least some moments when we feel our patience is wearing off and it's wearing a bit thin. We know that during this time especially, we feel like we want to venture out and go into the world that we once knew. We want to return back to our normal routine and activities. Well, I think in some ways, it's somewhat of a rude awakening for those of us who are not caregivers, what caregivers experience on a daily basis, because they feel isolated and they cannot return to their normal routine and everyday activities. And these current crises are simulating that similar experience for us as caregivers go through. So my apologies. I don't know how my Siri picked up something I must have said that I hope you didn't hear that in the background. Siri picked up. I apologize for that, even though I put my phone on mute. Perhaps give me a second. I'm going to turn it off because even the mute doesn't affect. So, John, if you would please advance to the next one. So, given the impact of caregiving on health and the burden of caregiving on the person's health and well-being, we wanted to focus on 3 areas. And if you look at this stool, we look at it as a 3-legged stool. So we wanted to look at linkages to care. And linkage to care, we have been looking at the HIV rapid testing and referral model to apply that and adapt that to caregiving, identification of caregivers, and referral to services in a rapid level. Because oftentimes we know by the time an individual is identified as a caregiver and the individual, he or herself, identify themselves as caregivers, once their loved ones is diagnosed, sometimes it may take up to 1 year before they're linked with some sort of a service. And that can have devastating effects. So we want to rapidly connect and link people with services. The other thing that we were looking at in working with our stakeholders across the state was how can we create a universal helpline, both by on the web and by phone, to provide some support with the navigation of slew of services that are available. So coordination of those services. The other thing that we started looking at was how can we support caregivers, and in doing that, what we did was we worked with our stakeholders and the service providers in Arizona. We took the one county, which is Maricopa County, as our largest county among the 15 counties with our diverse geographical spread in Arizona. And we formed a public-private sector partnership with these service providers and the foundations, private foundations, to look at how we can bring them together to reduce the silos and encourage coordination, or to improve coordination of services among all those service providers in Maricopa County, again, as one of our largest counties in the state, to at least identify some opportunities in order to create some linkages and coordinate services for care providers before we scale that across the state. So we were able to forge an alliance that became the Arizona Dementia Caregivers Alliance, now called Dementia Caregiver Alliance, with the intention of bringing cross-sector service providers to collaborate on funding opportunities in Maricopa County to address the substantial and rapidly growing needs of caregivers of those with dementia in Arizona. John, if you would advance, please. Thank you. So the map that you see in your slide on your screens depicts a social network analysis of services in Maricopa County. And you see all the blue dots are representative of services that are pretty much concentrated in certain areas of just the greater Phoenix metropolitan area and the outskirts of Phoenix, Arizona. So in the northeast, northwest, southeast, southwest quadrant, we see that this services are becoming more and more scarce, and people would have to travel long distance, sometimes over an hour, in order to reach a service provider. But the intention here, again, in working with the University of Colorado in Denver to coordinate this social network analysis, was for us to identify where the service gaps are and how can we better coordinate services. Next. This, again, is part of the traveling photo exhibit for caregivers. Some of the things that we must be mindful of are the picture on the upper left corner reminds me of the need for us to be mindful of inclusion and diversity and cultural agility. The photo on the upper left is a photo of a mother whose name is Ada, and we have permission to share this with her son. In their culture, in the Hispanic Mexican culture, men don't want to be shown with disability. So she could only hold the photo of her son who has dementia. And the picture on the right lower side speaks volumes to me. And it really touches my heart, because this, for a caregiver, there's a thin line between grief and guilt. This one, Duet calls this photo exhibit as grief observed. The man who took this photograph, and as he did most of the images in the traveling photo exhibit, he's the son of the couple in the picture. He said that his mother died shortly after his father, and his mother, who was a caregiver, died shortly after his father because the stress on her was so great. He took this photo the day his father died. So oftentimes, again, we see the burden, not only the burden of caregiving, but the impact and the mortality among caregivers. Next, please. So what we did as a result of our partnership, our social network analysis, and the formation of what is now called the Dementia Caregivers Alliance, was and in response to our county public health partners, the Arizona Department of Health Services, that I will be referring to as ADHS for short, was responsive to the needs of our counties by and the popular interest in coming up with some sort of dementia caregiver self-management support program. As a result, in response to our 15 counties, where we held a summit in 2018, we started looking at what is available out there, and we provided them with a menu of options on self-management programs, evidence-based programs, as well as promising practice programs that they could employ and include in their strategies public health strategies to help folks who are caregivers who are also often afflicted with some chronic condition, such as diabetes, heart disease, and other chronic conditions. Based on the input that we received, the surveys, as well as meeting with our county public health departments, we were able to respond to their demand by identifying a program called Finding Meaning and Hope, which is a promising practice dementia caregivers self-support, self-management support initiative. And we've been working on, it's a curriculum-based program, by the way, and it's a 10-week program based on some video discussion series, and a curriculum-based training that a trained facilitator holds with caregivers. We were able to also start working on a training of the trainer model for our public health professionals who are stationed at our county public health departments. So they're actually the staff at county public health departments who expressed interest in being trained in order to deliver this program. The curriculum for the public health professionals included training, a 2-day training, and the skills of facilitation training, as well as training based on the curriculum that Duet had put together. The training materials for the session were provided to the county teams. We wanted to identify at least 2 county health staff from each county to go through the training, and I'm just delighted to share that 12 of our 15 counties expressed interest in being trained and in including the Finding Meaning and Hope, which is based on the years of work of Dr. Pauline Boss on ambiguous loss. And if you haven't heard that term before, Dr. Pauline Boss out of University of Minnesota talks about how in dementia, with Alzheimer's and dementia, the person is physically present, however, psychologically absent. And the grief associated with that ambiguous loss can be just emotionally tolling on an individual and taxing on the individual. So this curriculum is designed to help individuals who are caregivers. And there are other opportunities that we're looking at in working with Duet through a contractor through our ADHS who is working with them in expanding the curriculum to ensure that there is continuity of services, wraparound services, including creative arts, mindfulness training, as well as some type of continued group support that they can be engaged in long after the 10-week program. The other thing that we have done is to look at how we can monitor and evaluate the outcomes of this initiative once the counties start rolling this out through their communities. In doing so, what we did was we started a pilot with one of our counties, and that pilot was incidentally very successful in attendance. We developed a pre and post survey evaluation of the curriculum and with the participants. And we're looking at the number of participants, numbers of completers, and then we're looking at 3, 6, and 12-month longitudinal follow-up evaluations to look at how this curriculum is impacting the life of these caregivers. In public health, we all work side by side every day with a common goal that we share to improve quality of life for our constituents. And in doing so, we always are mindful of how does this reduce the burden on our constituents, on our fellow Arizonans, and we want to look at that on a long-term basis. And I know that some of my fellow colleague speakers are going to be talking and diving deeper into the caregiving services, education, awareness, and as well as what resources that they have developed in Wisconsin. And I'm aware that Dr. Edwards from CDC is going to be talking about more about BERFIS as she dives deeper into how that works. And in our case, we do look at the behavioral risk factors surveillance system, the BERFIS, as one way to inform us what the needs are and what the burden of caregiving is. And so we value the need for BERFIS in and alternating between the cognitive modules as well as the caregivers module. The other way that I shared with you is how we are looking at monitoring, evaluating outcomes of our caregiver self-management initiative as a promising practice program. Next, please. So I would like to share with you a quote from Dr. Pauline Boss, and this way you can look her up. Caregiving is dangerous to one's health. Caregiving need the people in their life. Caregivers need the people in their life, especially now during these changing times. As one of my respected colleagues, Kelsey Donnelly with ASTO, mentioned to me the other day, we are all adapting to a new abnormal. So please be mindful of caregivers, as John shared at the beginning of our presentation today. Let's be mindful of their needs during this time. And they need people in their life, their work colleagues, healthcare professionals, faith community members, family and friends, to be more understanding of the sheer complexity of their daily existence. Their journey of trying to do the right thing in an untenable situation is long and hard, and it requires more acknowledgement and community support to come through it with their health and well-being intact. Next. This is Dr. Pauline Boss, who wrote an amazing book called Loving Someone Who Has Dementia. And I've provided the URL, the link, web address for Duet, Partners in Aging, and their phone number for additional information. And if you would, next, John. If you have any questions, there is my contact information. I appreciate your time, and with that, I'll turn it back to you, John. Thank you.
Thank you so much, Dr. Nayeri. And I do want to make sure that we hear about that wonderful Wisconsin example that you brought up. So I'm going to roll right into our next presenter. Kristen Felton she began working in dementia care as a frontline staff member in an assisted living facility before becoming director of a 16-bed community-based residential facility. In 2006, she began working at the Wisconsin Department of Health Services with a focus on aging and disability resource development. And 4 years later, Kristen shifted to the Office on Aging, Caregiving with a new focus on policy for Alzheimer's disease and other dementias, where she now serves as the department's dementia specialist. In this role, Kristen created the Dementia Care Specialist program and provides leadership on the new Wisconsin State Plan for Dementia. She holds a BA from Ripon College, a certificate in gerontology from the Wisconsin Institute on Aging, and a master's of social work from the University of Wisconsin in Madison. Thank you so much for joining us, Kristen. I'll turn it over to you.
Great. Thank you so much for having me. Next slide, please. So I wanted to start this off showing you a bit about the structure that we have here and where I sit within our Division of Public Health. So within our Department of Health Services, our Public Health Division has within it the Bureau of Aging and Disability Resources, which has within it the Office on Aging, where I sit. I am the dementia specialist for the department, but work within the auspices of the Public Health Division. Next slide, please. So we received a grant from the Federal Administration on Community Living, ACL, back in 2014, and there were 4 specific aims that they were requesting happen as a result of the funding from that grant opportunity. One of them specifically was to help family caregivers to understand and to better manage and address, quote, challenging behaviors for the person that they're caring for. In bigger context, this was also at the time that our state was doing a statewide dementia care systems redesign plan. We were already working with our University of Wisconsin at Oshkosh Center for Community Development, Engagement, and Training to provide trainings for various professionals, but there wasn't anything specific for family caregivers related to behaviors. So we worked with UW Oshkosh Cadet again, to develop this online training module. And it's something that I feel it fits. It's a very nice niche area. Because it's online, it's obviously not accessible for everybody, but the more options we can have on the menu of available supports for caregivers to choose from, the one that they feel most comfortable with, the better off we are. So next slide, please. So we created this online training, and we wanted it to be easy to use for caregivers because, as we all know, caregivers have very chaotic days at times. They don't have time for themselves to sit down and read through lengthy amounts of information. Perhaps they can't get away from the home to attend support groups or in-person training sessions. So this online training, as you can see, this is the landing page, and on the left side is our navigation bar. The content is about 2 hours in total, but each one of those different areas you can click on and go to just that particular topic. So it was designed to be available in very small bites, available to return to a particular topic that you maybe didn't need in the past when you were accessing the training, but now it's become an issue, so you wanted to go back and just hear about that one thing. So it's something that was intended to be easy to navigate and available even in the middle of the night if necessary, and in small enough portions and bites that's not overwhelming for very busy caregivers. It's something as well that we have accessible through closed captioning is available, and it's also a voiceover narrative that accompanies the visual slides. Next slide, please. This is the link to the training if anybody wants to go there and check it out. It's free and available on our state DHS website at no cost, which I felt was very important, and to make it as accessible as possible. Next slide, please. This is an overview of the contents, basically an introduction, brief overview of dementia, self-care tips for the caregivers, communication, how to respond to symptoms, specific strategies for agitation and aggression, as well as additional considerations, things that come up in the course of caregiving for someone over time that are not necessarily traditionally thought about including in caregiver supports, and then resources and available things that they can continue to educate themselves or make connections through. Next slide, please. This is an image from the training itself, basically an overview of a set of symptoms. It talks a great deal about the fact that this is a disease, that there are many different diseases and conditions that are causing the symptoms that you're seeing, because these different areas of cognition within the person's brain are being affected. So there can be a wide variety of symptoms. And the behaviors that families see are symptoms of a condition. That can be a very difficult thing for family members to truly wrap their heads around, that, you know, the reasons why that person is behaving the way they are potentially disease related and symptomatic. So helping family caregivers to put that frame around what's happening for their loved one. Next slide, please. This section, I have two parts of it. So it specifically speaks to the family caregivers of a person with dementia, giving them little tips like the one you can see just below it, like therapeutic fibbing. Sometimes people are very concerned. They've always been honest with their loved one and don't want to lie to them, and yet giving them permission to use the therapeutic fibbing as a strategy to help manage the situations that they come across with their loved one. Next slide, please. There are videos that are embedded within the training. There are 8 different videos, because it can be difficult if you're simply just reading how to respond to a particular behavior. It can be difficult to really envision, well, what does that really look like? And oftentimes people are better able to perform new approaches and do different things if they see someone they can simply role model. So we have videos in there showing people what the proper response is to various behaviors. And people recognize the various behaviors that they're seeing in the person with dementia, and then having somebody model and role model the best way to respond to that behavior. Videos, I think, are a very important part of the training. Next slide, please. So again, it covers probably, I should have looked this up, but there are about 12 or 14 different behavioral symptoms that we address and give suggestions on how to respond and approach. And one of them that is very difficult for families can be responding to the repetitive questions and thoughts. Being asked the same question over and over again can be exhausting. So some tips about why that might be happening and how potentially to respond to help alleviate that need that the person with dementia has to convey whatever it is that is in there that's going on for them at that time. Next slide, please. Agitation and aggression, also something that caregivers struggle with a great deal, and is discussed. What you're looking at are really just the slides. There's a great deal more information around these topics in the narration, the voiceover narration or the closed captioning that goes along with these images. But thinking about what the causes behind agitation and aggression might be and being able to address those things. Next slide, please. Continence, something that family caregivers, sometimes it's the straw that breaks the camel's back, but helping caregivers to understand that it really is something that they can manage, that there are things that are available to support them. Keeping a routine is so very helpful, as well as having people come in to assist with laundry, letting caregivers know that these options are out there for them and they don't have to do it all by themselves. Next slide, please. So the results of all this, we intentionally don't have a very robust evaluation of this because that would require caregivers to go through that. And we didn't want the evaluation to be an obstacle to caregivers accessing this information. So we do have a voluntary survey that probably a dozen people have taken, but we've had over 1,000 people view the training over the past year, and anecdotally we've heard great things, very positive things about having this in this format. We did focus groups of caregivers, various caregivers, to develop the contents to even talk about things like, do you consider yourself to be a caregiver or a care partner? What's the proper language we need to use? And many of the focus groups said caregiver really felt appropriate for them, and that they felt strongly that that section on caring for the caregiver, taking care of yourself, should be at the front of this training. So we have another grant that we've received from the Administration for Community Living, and under that grant we are planning to translate this training into Spanish. We'll be reshooting all of the videos with Spanish-speaking actors, and we'll be making cultural adaptations and changes to the content, the way that it's presented. We've already done focus group with the Spanish-speaking professionals, and I'll be talking with family caregivers as well to see how we can adapt and make this online training available in Spanish and in culturally appropriate ways. Next slide, please. So this is me. If anybody has any questions, that's my contact information, and I'll be happy to talk to anybody who is interested. Thank you very much.
Thank you. Thank you so much, Kristen. I do want to keep things moving right along, and so it's my pleasure to introduce our last speaker for today, Dr. Valerie Edwards. She was employed by the Centers for Disease Control and Prevention for 20 years. She received her PhD in social psychology from the University of Texas at Austin. Her research was in the areas of caregiving, healthy aging, mental health, and gender. We're so pleased to welcome her today. And just as a reminder for everyone, all our participants on the webinar, even though Dr. Edwards will be going through a lot of numbers pretty quickly today, we will be sending out a copy of the slide deck so that you can review them as you please. Dr. Edwards.
Thank you, John, and thank you, Kristen and Babak, for your presentations. I'm just going to be talking about today the results from the caregiver module of the Behavioral Risk Factor and Surveillance Surveys, the data that was collected in the years of 2015 to 2017. Next slide, please. And just a little bit for those of you who aren't familiar with the BRFSS, the BRFSS is truly a national treasure. This is the longest continuously operated telephone survey on health in the country. It gives us the ability to track health status over time. It encompasses a very broad range of health behaviors and conditions. And for most states and territories, it's really their go-to point of data. We include all non-institutionalized adults 18 and over are eligible to participate through random digit dialing. In 2018, over 450,000 U.S. residents were surveyed, which gives us an incredible amount of power in order to analyze information. Next slide, please. Next slide, please. And just wanted to give you a little bit of background about how critical caregiving is and how shifting demographics are going to make caregiving an even more critical issue. In 2010, it was estimated that for every person over 80 years and older who needed a caregiver, there were approximately 7 family members available. However, by 2030, that number is going to decrease to 4 people for each person who needs caregiving. And this is because of changing demographics in U.S. society. Next slide, please. For instance, the number of childless older adults is growing. In 2010, 11.6% of women aged 80 to 84% were childless, but this is going to reach 16% in 2030. And by 2050, almost 1 in 5 women aged 80 and 84 will have no children, thereby severely cutting down the number of available informal family caregivers. Just wanted to give you a little bit of information on that and why it's so important to collect information about caregivers. Next slide, please. We were able to add what's called an optional module to the BRFSS survey that had the screening question that asked, during the past 30 days, did you provide regular care or assistance to a friend or family member who has a health problem or disability? close to 21%, or 53,000 BRFSS participants yet said yes, and this is over our 3-year period of data collection. Next slide, please. Next slide, please. Can you go back one slide, please, John? Okay. Over 44 states, the District of Columbia, and Puerto Rico collected data from our caregiving module. And this just shows each state the year that was collected and which they collected data in which year. These data were combined to form a data set that combined all 44 states, DC and Puerto Rico. Next slide, please. Here's the caregiving prevalence by state over those 3 years. The largest, the darkest blue indicates the state that had the highest quartile of caregivers, from 21.9 to 34.4% of respondents saying yes, they were caregivers. And you can kind of notice that's in a swath across the southeast and reaching out a little bit towards the western states. And the lowest states prevalence were kind of scattered around through the west and the upper Midwest. Next slide, please. So who are caregivers? Overall, we found that most caregivers were under age 45. They were women. They were members of a married couple or members of an unmarried couple or married. They had some college, and they were white, non-Hispanic. Next slide, please. The largest group of caregivers were under 45 years of age, but over 20% of all the caregivers in the sample were over 65 years of age. Utah and DC had the highest percentage of young caregivers. Over 55% of caregivers in their states were under 45, while in Florida and Oregon, over 25% of caregivers were 65 years of age or older. Next slide. Overall, women were 58.1% of caregivers. Maryland had the highest percentage of women caregivers at 62.6%, while the fewest women caregivers were in Alaska, where only 53% of caregivers were women. Next slide. In terms of race, most caregivers were white, followed by Hispanic, African American, and other, including Pacific Islanders, Asians, and mixed race. Most African American caregivers were in DC, where over half were African American. Most Hispanic caregivers was in California with 35.5%, and most other race caregivers were in Hawaii with 64.3%. Next slide, please. In terms of employment, 56.8% of informal caregivers reported that they were employed full or part-time. The highest employment levels were in DC and South Dakota, which both recorded over 2/3, or 66.1% of caregivers being employed, where in Puerto Rico, only 37.8% of caregivers reported working full or part-time. Next slide. Now, as far as dementia caregivers, they tended to differ from other caregivers by demographics, by their health status, and by the caregiving situation in which they were in. Next slide. Looking at people who were caregivers for people with dementia or Alzheimer's disease versus caregivers of folks or people with other kinds of conditions, dementia caregivers were more likely to be caring for a parent or a parent-in-law, more likely to be age 65 or older, and less likely to have children in the household. Next slide. In terms of their health status, Dementia caregivers were much more likely to have frequent mental distress at 28.6% reporting mental distress versus 17% of other caregivers. However, they were less likely to have frequent physical distress. Only 13.1% of dementia caregivers reported physical versus 15.1% of other caregivers. Next slide, please. In terms of the caregiving situation, compared to other caregivers, dementia caregivers were more likely to have provided care for at least 2 years, 53% versus 49.8%, and they were more likely to provide 20 or more hours of care per week, 31.3% versus 29.3%. Next slide, please. And that concludes my presentation. These are data that were obtained from the 2015 to 2017 BRFSS survey, and I encourage you to find more of our information at cdc.gov/aging. Thank you.
Thank you. Thank you so much, Dr. Edwards, and thank you to all of our presenters for today. We are about ready for Q&A, and I know we're coming up against the end of the hour. If we do not get to your question today, please feel free to ask it, and we'll follow up after the webinar. I want to remind everyone to think of that Chief Health Strategist framework that we discussed at the beginning, so that it can begin to percolate and hopefully spark some ideas for you in your own community. But in order to give us some context and help provide a view of the national landscape, I'm going to turn it over to Mike Wittke, the Senior Director of Public Policy and Advocacy for the National Alliance for Caregiving. He's going to provide some discussant remarks for all of us. Mike?
Thanks, John, and thanks for everybody for taking some time today to be on this webinar. It's a very important topic, and I think very timely considering the issues we're going through regarding the pandemic. And how it relates to families and those in healthcare settings. Just real quick, I just want to give you a quick overview of who we are. We're an alliance of national organizations who are all dedicated to improving the lives of family caregivers. We've been around for over 20 years with the sole focus of doing research and public policy analysis solely on the topic of these informal or unpaid family caregivers that we've been talking about here today. And our work has been pivoting quite a bit lately as this, as we're learning how best to respond to this COVID-19 emergency. One of the things that we are seeing is as the biggest challenge, especially as it relates to the population we're talking about today, is how families are being, prevented from entering into healthcare settings so that they are not able to inadvertently spread the virus to those who are most vulnerable, and since caregivers are oftentimes the most closest people in contact with those who are most vulnerable to this pandemic, then it's obviously something that's drawing a lot of attention to this topic. I wanted to just highlight that this is something we've been thinking about for a while now as an organization, and that we've been trying to have a discussion amongst the larger public health field, healthcare settings in general. We published a report in 2017 that actually kind of summarizes some of the things that the speakers here spoke about today, talking about this issue of caregiving as a public health challenge. And it's not just dementia caregivers, it's caregivers of all different types of conditions and in different types of settings. And what you heard from some of the presenters today, just to summarize, some of the challenges we highlight in that report is this growing care gap, the fact that there are just not going to be enough caregivers for those who are going to need care in the future. And the other challenge that we have is we just don't have enough data to know exactly where we can be making the policy case as to how we can best support caregivers. And it describes a little bit about what that means, but I'll just give you an example. There are some studies that talk about caregiving and how many, for example, the prevalence, how many caregivers there are in the country. But depending on the definitions of these studies and the way that they go about collecting this information, you have somewhere in between essentially 17 and 90 million caregivers. Well, it's really hard to go to a policymaker and help identify this issue when there's such a gap and a chasm in terms of where the data collection methods are being implemented, and the definitions and inconsistencies around those, and addressing caregiving from a public health issue can allow us to get at some of those data challenges. Another thing is, we've heard that caregivers are the backbone of the long-term care system, but one message that I think that we can be cementing via this webinar and this conversation more in general is that caregivers are core to the nation's public health. And you can look, by looking at caregiving through the public health lens, you're not just looking at caregiving, for example, in the context of dementia or related Alzheimer's or related dementias, but you could be thinking about how does caregiving as a public health issue, as an umbrella term, look at caregiving not only through caregiving of people, caregivers of people with dementia, but caregivers of people with cancer, caregivers of people with mental illness, caregivers of people with disabilities, and across the board, and how this larger public health infrastructure would address this population. And so just some of the reflections, just to highlight some of the things that came up on the webinar today. The caregiver module, that's a wonderful tool that I think can be expanded and improved on to help get at some of the data collection challenges that we see. There's a lot of initiatives that are being led, through the Healthy Brain Initiative. There's a lot of work that's being done to address caregivers in this way, and there's a lot that we're learning from that that I'll speak about just in a second here. And the other thing that's great about what we've talked about today is the continuum of how you would address and serve a caregiver by identifying and assessing a caregiver, and then providing them with, and referring them to support services that are appropriate to the types of conditions of the people that they're caring for. And I don't know if it'll come up at the end of the webinar today, but there was a law recently passed called the BOLD Act, the Build Our Largest Dementia Infrastructure Act, that really kind of speaks a lot to this need to really enhance the public health support infrastructure, and caregivers fall right in the center of what it means to build out that infrastructure. Connections from the conversation we had today to the larger national landscape. One thing I think to just highlight again is that caregivers play a key role in connecting healthcare with social services. So they are the one through line, essentially, usually when you have somebody who's going from service to service or from agency to agency or whatever, across these different settings that caregiver or that care recipients are in, the caregiver is usually the one person who can help connect all those dots. And by formalizing them much more within the care team, you can really, improve the way that we address social determinants of health. The other thing that this conversation gets at is the discussion around achieving the triple aim. So if you are addressing caregivers through a public health lens, you are looking and by improving the data collection, and understanding where caregivers need services and where they're going for services, and where those services are actually showing improvements. We can learn about improved health outcomes, where cost savings are found, and by serving caregivers better, that care is more aligned with personal preferences. And lastly, we need to be calling on governors, public health departments to think about how caregiving in their context, the roles of the context of the roles that they serve, fits. These are probably two of the largest influencers that we can be calling on to really move the needle forward to address caregiving as a public health issue, to get governors and other influencers to identify this as a priority, and then get public health departments and public health experts to determine how best to serve caregivers in their areas. And lastly, just to give a little encouragement that this community can draw from to move forward, is that now within the CDC specifically, the division of folks who are looking at cancer prevention and cancer care services are starting to draw from what their colleagues who have been involved in the Healthy Brain Initiative work has been doing around caregivers. And so we're starting to see that the dementia and Alzheimer's space is really leading the way in this conversation. And now other conditions and other fields are starting to draw from what speakers earlier today talked about and how we can adapt those to serve caregivers of other conditions. So I'll leave it there. Thank you, everybody.
Thank you. Thank you so much, Mike. I always find it helpful to keep that broader, larger national picture in mind. And you did actually bring up the last thing that I'll say. I know that we're over time today, but do want to encourage everyone to take a look at the Bold Infrastructure for Alzheimer's Act notices of funding opportunity. Mike just mentioned these, and this is what we teased at the top of the hour. But please visit cdc.gov/aging to learn more about them. This is specifically funding to help support implementation of the Healthy Brain Initiative roadmaps through establishing centers of excellence, as well as supporting state, local, and tribal public health programs. Please learn more at cdc.gov/aging. And since we are over time today, I'm going to forgo question and answer. But if you did ask a question in the chat, well, we'll be sure to follow up individually after this. Just some final resources for everyone that's still left on the call. Please take a look at these. These are great resources for caregiving, dementia caregiving, as well as in the current climate with COVID-19, updates and specific resources for those caregivers dealing with this pandemic specifically. My name has been John Sheehan. I'm the Associate Director of Public Health here at the Alzheimer's Association, and I thank everyone so much for your time today. Please look for an email from myself and Molly French later today requesting feedback on today's webinar, as well as an email from me later this week with a link to the recording, a copy of the slide deck, as well as the links that were featured today. Thank you so much for joining us, and take care, everyone.